Question 1. A 25-year-old man presents with recurrent episodes of sinusitis and pneumonia. He has a history of chronic diarrhea and recently developed lymphadenopathy. Lab results show serum IgG, IgA, and IgM, plasma cells, normal B cell count, negative HIV test. Which of the following is the most likely diagnosis? A. Selective IgA deficiency. B. X-linked gamma-globulinemia. C. Severe combined immunodeficiency, CVID, common variable immunodeficiency. E. Hyper IgM syndrome. D. Common variable immunodeficiency. Explanation: CVID is characterized by a defect in B cell differentiation, leading to plasma cells and immunoglobulins of all classes. It usually presents after puberty, unlike XLA, which presents in infancy. The patient is also at risk for autoimmune disease, lymphoma, and bronchiectasis. A. Only IgA is low in selective IgA deficiency. B. XLA presents in infancy and shows absent B cells. C. CVID presents in infancy with T and B cell dysfunction. E. Hyper IgM has IgM and IgG-IgA, usually from CD40L deficiency. A 33-year-old woman is referred for recurrent bacterial respiratory infections and fatigue. She is found to have low levels of all immunoglobulins, normal B cell count, and decreased plasma cells. Which of the following complications is she at greatest risk for? A. Autoimmune hemolytic anemia. B. Myasthenia gravis. C. Anaphylaxis to IgA and transfusions. D. Cystic fibrosis. E. Wiskott-Aldrich syndrome. Correct answer: A. Autoimmune hemolytic anemia. Explanation: CVID is associated with an increased risk of autoimmune diseases, including autoimmune hemolytic anemia and immune thrombocytopenia, due to impaired immune regulation. B. Myasthenia is not classically associated with CVD. C. Seen in selective IgA deficiency. D. Cystic fibrosis is a genetic disease with thick mucus, not related to immunoglobulin levels. E. Wiskott-Aldrich involves thrombocytopenia, eczema, and infections in infants. Question 3. Which of the following best explains the pathophysiology of common variable immunodeficiency? A. Mutation in the BTK gene preventing B cell development. B. Deficiency of adenosine deaminase. C. Failure of B cells to differentiate into plasma cells. D. CD40 ligand deficiency impairing class switching. E. Absence of IgA synthesis with normal IgG and IgM levels. Correct answer: C. Failure of B cells to differentiate into plasma cells. Explanation: CVID is due to a defect in late B cell differentiation, leading to decreased production of plasma cells and hypogammaglobulinemia. The exact cause is often idiopathic. A. BTK mutation, X-linked gamma-globulinemia. BADA deficiency. D. CD40L deficiency, hyper IgM syndrome. E. This describes selective IgA deficiency. Would you